For decades, doctors have diagnosed prostate cancer using what's been called a blind biopsy, removing and testing a dozen tiny tissue samples to see if cancer is present. Now, new technology is taking the guesswork out of the procedure by allowing doctors to precisely target suspicious areas where deadly cells may be lurking. High-tech images and an electromagnetic tracking system like GPS for the body, together giving doctors more information than ever before.
This is your whole prostate. This is the area that was we evaluated.
Arsenio Miller has prostate cancer, but he feels good knowing that doctors have a very clear picture of his condition.
More lesions came out, more spots were detected.
Doctors found cancer in an area of Arsenio's prostate that would not have been targeted by a traditional biopsy using a system called Urana. Urana fuses together a patient's MRI and ultrasound to create a highly detailed 3D view of the prostate.
We're able to guide the needles in the treatment area and just focus on that specific spot.
Dr. Art Rastenad inserts the needle precisely using this computerized grid. He does the biopsy by going through the skin.
The infection rate is much lower in this approach because we're not going through the rectum.
Arsenio suffered an infection after an earlier traditional biopsy. For him, this technique was a relief and may bring him one step closer to good health.
Thanks to good doctors that I had been able to meet and that had been able to treat me and give me assurance that I will be cured from this disease.
Dr. Rastenad says between 2 and 7% of all men who undergo traditional biopsies will get an infection. With the Uranov and a biopsy through the skin, the rate is less than 0.5%.